So let's talk about what is COVID-19. So we've seen lots and lots of information about this in the press as well as in the medical literature. It's a novel coronavirus. It's SARS-CoV-2 is what it's been called. And the outer proteins of the virus form the crown, and that's why it's called the coronavirus. And it's a very transmittable virus between humans. And this has made it very much a global pandemic very quickly. So when we talk about how we diagnose the infection, the gold standard is a PCR result. Now, initially, a couple of months ago, there was limited availability of the testing kits. And so that really did make it challenging for diagnosis. And in some parts of the world, that is still the case. The processing times for the PCR test, of course, will blow out as the demand increases, particularly if your local area develops an increasing number of infections. The nasopharyngeal swab technique has approximately a 60 to 70% sensitivity, and that really does depend on the handling of the specimen, the adequacy of the specimen, and of course the stage of infection when the specimen has been acquired. If we develop point of care tests, then this should provide a faster result. And it does, of course, cause a lot of difficulty for patients presenting to your emergency department who have symptomatic features suggesting the infection, but the first swab comes back negative. And that has caused difficulties in many centres. We are in the process of seeing more and more point of care tests being developed, as well as some home test kits being developed as well. And the thing to note about that, with the home testing in particular, is that the swab technique is really important to make sure that it's accurate. And really what we're talking about with the PCR testing in the acute setting is current infection, but antibody testing to establish your immune status after you've recovered is equally important for long-term management of this infection.